Hello, everyone, and welcome to another episode of the IoT For All Podcast. I'm Ryan Chacon, and on today's episode, we're going to talk about what IoMT is, what it means, and how IoT is playing a role in the healthcare space, along with AI and ML. With me today will be Brad Womble, the Senior Director of Strategy, Marketing, and Mergers and Acquisitions, and for healthcare at Jabil. They are a global manufacturing services company. A lot of great stuff in this conversation. I think you'll get a lot of value out of it. Please feel free to subscribe to our channel if you haven't done so already. Like this video by giving it a thumbs up and hit that bell icon so you get the latest episodes as soon as they are out. All right, on to the episode. Welcome, Brad, to the IoT For All Podcast. Thanks for being here this week.
Thank you. Appreciate the invitation. Nice to meet you, Ryan.
You as well. Yeah, I'm very excited for you to be here. I'd love to kick this off by having you give a quick introduction just about yourself and the company for our audience.
Yeah, awesome. Well, my name's Brad Womble, and I work for a company called Jabil, and we specialize in a lot of different areas, industry-wise. Healthcare is certainly a big focus of ours, and we roughly a $5 billion division within Jabil, and it's definitely a fast-growing area. Jabil supports a lot of other industries, though, that sort of complement that healthcare space. We're in aerospace and defense. We're in automotive and transportation. We're in industrials. We have a big consumer devices group, which does smart home and appliances and mobility and AR, VR. So we're a fairly diversified contract manufacturer that works for our customers in terms of helping them build products as well as other types of business solutions.
Fantastic. So I wanted to jump in here. I know you mentioned the role you all play in the medical space, which I think is an interesting topic for us to start with. And a new term that has kind of been thrown around, and I know came up in our early discussions before the recording, was the term IoMT. And I wanted to see if you could kind of break down and explain to our audience, what does IoMT mean at a high level, and then talk about how IoT is really playing a role in healthcare. And we can dive further into that once we kind of get through the beginning.
Sure. Yeah. Well, very, very simply put, IoMT stands for Internet of Medical Things, which is obviously a subsect of the Internet of Things, in general. Right. But more specifically, it's really about interconnecting medical devices together, wearable technologies, and healthcare applications, sort of weaving that web, if you will. Is really what constitutes the Internet of Medical Things. And I would argue that there's probably other types of applications related to supplements and food and exercise that also sort of play in to that as well. But it's a term that really encapsulates the ability of capturing data from many different types of devices and applications to really help better support the consumer or the patient using those devices.
And a lot of those technologies and devices that are out there now are really helping support kind of guidance when it comes to wellness and being something that's always actively monitoring and actively supporting that initiative. And I guess if you could dive a little bit deeper in talking about how IoT in general has really enabled the healthcare space and the wellness space to support the ability to provide guidance for people to stay healthy and to monitor key health indicators on a regular kind of real-time basis.
Yeah, I would say that, IoMT in particular is really the essential part of that equation. And it really allows us to do real-time or close to real-time monitoring of both consumers and patients to really help with that wellness. So really, I guess one way to really think about how strong of a role IoT is playing is that this is the first time in a long time. So let me just kind of step back for a second. So Sure. We've known about the importance of personalized medicine for a long time. And personalized medicine is really providing the right treatment at the right time. And even Hippocrates and Galen, some of the ancient Greek doctors, 2,000 plus years ago, 2,500 years ago, they knew that treating the individual is the most important thing, and that you don't treat the same two individuals the same way, even though they might have the same disease. You actually treat them differently depending upon who they are, their age, demographics, a lot of other profiles. So we've known about personalized medicine for a long period of time, but it's only today that IoMT in particular is really enabling us to see the vision of what Hippocrates and Galen knew 2,000 years ago. So we're now able to match the technology, with the personalized medicine so that we can really kind of put those two together. In the past, it would be difficult to have a physician for every person on earth, but having technology that can actually monitor the patients and ask the right questions, as part of follow-up physicians, or if it's, preventative medicine for, consumers like you and me, it really is enabling that capability. So it is a pivotal kind of tipping point in our industry,
Okay.
this technology.
Yeah, and one of the things that's been interesting lately, we've been talking a lot about AI, ML as well, and these technologies being able to benefit from large data sets, which IoT is enables, right? Is enables data collection, real time information gathering that we didn't potentially have access to previously. And now having that data available, you can start to build these AI models and ML models and bring them into the solutions. But I'd love it if you could tell us a little bit more from your perspective how AI and ML are kind of utilizing this new IoT data to provide value in the medical space.
Yeah, it is the key element. So, I mean,
Okay.
you could collect all the data in the world. As a matter of fact, I'm wearing a Whoop band as well as
Right.
an Apple
Sure.
Watch. But even though these two things collect more or less the same type of information, the way they display that information to me is actually quite different. I mean, for instance, like on the Apple Watch, all of my data, whether it's the heart rate variability, heart rate, steps, calories burned, all of that is stored in the health app. But it's not providing guidance in terms of how that data should be used in terms of me, say sleeping tonight, or how much exercise I should do, tomorrow. But what the Whoop band is actually doing is in fact taking that same data, but it's actually created an algorithm for me that's really helping guide,
Right.
my daily activities, how much exercise I should do, when I should go to bed, for sleep, how much sleep performance, sleep efficiency, and the ability of really, including a lot of data to create these what we call digital twins, for instance, is really what it's about. So it's using AI and ML to create a patient digital twin, or consumer digital twin, whatever you want to call it, to really help guide and nudge a patient towards wellness, or if they're sick, help them understand, what might be the issue, and then for them to get, obviously consultation if they're
Right.
actually having an illness.
Yeah, and I'd be curious to learn too about kind of the digital twin playing a role in this space. I know we've talked about in the past kind of what digital twins are and how they're benefiting just IoT in general. But as it relates to the medical space, um, I know digital twins are really working to provide even more insights and more value. Can you take us kind of through that kind of role and the benefits of the digital twin in IoMT?
Yeah, absolutely. Well, first, let me just kind of talk about the patient digital twin. I feel is ultimately, what's really going to help guide, a patient towards, better quality life. And I think that, patients that are sick can use it. Ryan, you and I can use it, for just, hopefully keeping ourselves healthy, and even
Right.
more healthy into the future. But when you start putting a lot of these different patient digital twins together, let's say that all of a sudden, we have knowledge of, 100,000, digital, patient specific digital twins. Is there a population digital twin that we could think about? For instance, are there certain genetic factors that help you and me respond to certain drugs, in a more efficacious way, or in a less efficacious way. So, even pooling these patient digital twins from individuals and looking at it from a population perspective is really going to help, guide us in terms of, even better decision making, even better, drug formulations, even better treatment protocols that can help, even large masses as a result of just aggregating these the important results from these patient digital twins. The other element of it is, I call it a device digital twin. It's more of a digital thread, if you will.
Okay. Sure.
But the idea of the device being a key component in terms of the care of the patient, But then also in terms of how do we continue to improve devices, and how do we continue to customize devices to better treat patients. And
Right.
one of the things that we're really focused on is how do we one, monitor the health of those devices. How do we use that information then to help improve the next version of those devices to help better treat patients? So it's really this confluence between the devices and the actual patient digital twin and the data coming
Right.
in from the patients that's really linking together to really make these robust AI tools, these digital twin tools.
Is that kind of one of the potential advantages of using the patient digital twin for personalized medicine for like the broader kind of consumer base, or kind of where does this kind of go, and what is the advantages kind of long term look like in your opinion?
Yeah, I think that's a really good observation. So from a consumer perspective, we can use these digital twins, one, to help give early diagnosis for diseases or potential infections. Just to give you an example, it was a couple weeks ago. My son was a little sick. I didn't think that I'd gotten it from him, but I woke up with a really low recovery score. I was in the red, but honestly, I didn't feel any different. I mean, I actually felt pretty good that day, but it was only until the next day that I actually started feeling getting a sore throat and
Right.
feeling like there was something kind of in my lungs or whatever. So there was an early indication of that kind of showing up in my results that I thought was really interesting. But the other thing too is really about how do we continue to nudge towards wellness, right? So if our goal is to be healthier and fitter, that patient digital twin really becomes sort of a lifestyle coach for you and I. For instance, you may wake up with a really high recovery score in sort of the green, let's say, and it might suggest that you have a strain of 15. 15 is kind of like a moderate strain. It might suggest you have a workout that gives you a 15% strain. And then you do that workout and you may actually have only 11 strain, and it will say, hey, maybe do another, 30 minutes on the bike or something like that to really kind of hit that 15 strain threshold so that you're maximizing your recovery and you're maximizing, the benefit from it. So it really becomes a subtle lifestyle coach, I think. And I feel like that's something that consumers are going to really be able to benefit from. The key thing, though, is to continuing to add data, to it. Custom surveys, right? Like, did you take creatine today, right? And what is that showing up? Or did you avoid dairy? Or being able to track those things and kind of correlate it to how you're performing from a recovery standpoint is super important as part of that process.
Yeah, that's a super interesting point because, I mean, just as an individual, as I've gotten older, you start to understand how different things affect your body in different ways. You don't think about that much of a kid. You're kind of, built in a way what feels like you're indestructible. But as you get older, you start to see how you might be, and obviously your body changes, but you start to see and pay attention to how certain foods, certain activities, certain things affect the way you feel, whether it's activity levels, how well you sleep, how, do you feel nauseous, do your stomach hurt, whatever it is during the day. And it's really tough to kind of put a finger on what's triggering it unless you're very diligent about monitoring your intake of food, your activities, and so forth, which a lot of us are not. But if there is a better way to do that, or a way to kind of monitor that even at a high level to be able to help inform and guide people to make those right decisions, or better decisions, I should say, to just feel better about themselves and be able to interact with that through some kind of technology is very fascinating, and something that I think a lot of people, including myself, would benefit a ton from.
Yeah, I mean, I really do think it's the future, and there's a whole big area. We don't have time today to kind of get into it, but there's a whole big area of longevity medicine where there's literally physicians that are just focused on longevity, and there are some things that that we're talking about today that if we can kind of put them all together, are really going to help us stay healthier for longer, right? And when we look at the cost that we spend on healthcare each year, I think it's roughly 18.5% of the gross domestic product of the U.S. is spent on healthcare. It's a massive expense. Right. But the goal is how do we limit or prevent some of these chronic diseases from lasting? And the whole idea is if we can stay healthy, until we're 90 or 100 or 110 or 120,
Right.
the idea is that we're pushing that cost curve to basically the last say days of our lives, and we're able to really save a huge substantial amount of money, and also really improve the quality of life during these the elderly years, right?
Oh, I mean, it's interesting you talk about that, because there's so many different things that affect us as individuals that we don't think about until sometimes it's not say it's too late, but it requires more work to right the ship. And like being someone who's been involved in different athletics and different sports my whole life, I saw it a lot when I got out of college, started doing CrossFit a bit more, and I
Yeah.
was seeing individuals all the way up until their 60s doing this, and this hearing their stories about the quality of life and the improvements to their life that they were able to see when they started to just move their body on a regular basis. They were wearing different wearables to track their fitness, track their activity levels, tell them, hey, you need to drink water, you need to get up, you need to move, but just doing something on a regular basis. And this is obviously not the full scale of it, but just something that help them move their body, help them stay healthier, help them get more flexible, help them just not age as fast as you'd expect them to. The hearing how happy they are to have been pushed into doing something like that, whether it's CrossFit or going to the gym or whatever you do, the more information you have kind of promoting that and telling you why it's important and helping encourage you to do it, it's just going to extend and hopefully improve our lives for a longer duration of time. And if you include, the food aspect and diet and medication and health care, other, things that you can kind of help inform people on, it's a no-brainer. And it's just such a big place for us to go that we're going to look back in hopefully 20, 30 years and just see how quality of life has just improved, hopefully, from being able to collect and analyze and deal with this data.
Oh my God, yeah. I mean, well, first of all, my wife and I, we started a CrossFit gym 2 years ago, when COVID hit, and
Yeah.
that's honestly that's something that we really love doing together. But being a part of honestly that community, it does expose you to people thinking about health in kind of a new way. And
Yep.
case in point, there's several people at my gym that are actually using continuous glucose meters to track their glucose trends, but not just glucose, but also ketones as well, because they want to understand, when they eat, what is that glycemic index look like? How does their body respond to that? But then if they're doing sort of intermittent fasting,
Yep.
as well, are they getting maximum sort of, ketone, production during that period of time? Are they sort of hitting their fitness goals? And one of the things, Ryan, that I'm starting to see quite a bit with our customers here is that we're starting to see our customers that have purely focused on medical devices now thinking about how to take that technology and offer it to consumers. For instance, Abbott, they have a Libre, which is a continuous glucose monitoring device. They're actually in the process of offering a consumer version of that device, even though I believe it's more or less the same technology. Consumers can now benefit from the insights gained, from it as well. And I think you're right. I mean, I think consumers we're enabling consumers to really, start taking much better health. Obviously it takes effort to do it, but we're enabling it.
But it's just the access to that data and that information that we never had before. I mean, like I said, when I was growing up, and I'm sure all of us when we were growing up, we didn't have access to this information. You had to go to the doctor to have blood tests, different things to understand where you are from a healthy standpoint. And now if we can have it wear it on our wrists, or use a tool to kind of measure different levels within our body on a more regular basis, that's more readily available information that we can make decisions off of. And you start to see that even with, the growth of social media and stuff, there's now more and more information available, whether all of it is correct or not, just helping inform on things that we didn't really have access to unless we, took the time to go research it ourselves. But just people talking about different foods, the things we shouldn't put in our bodies, the things we should put in our bodies, just, debunking a lot of myths that have been around for many years on how to live a healthy life. It's just, when you kind of mix that information with now the ability to know as an individual, what do I need to look at within myself to know if I'm healthy and if I'm doing well, and that those are things that we didn't have without IoT and this data being able to be collected in real time for us to make decisions off of. And it's only going to get better. It's only going to mature and become more sophisticated. And with AI, ML, like digital twin, like we're talking about, we're just going to be able to do more and make better and faster decisions, which each time we collect data just helps build that up from the bottom. And it's very exciting.
I think you hit on a really key point, and that is, we are getting access to more data than what we were in the past. In fact, that was actually a big challenge. And by the way, it's still, I would say, still is a challenge. Is the silo data? We are still dealing, with a situation where certain companies are collecting the data from their devices, but that data, it really isn't an easy way for them to be able to share that data with the patient's physician, or in some cases even with, the patient. And so if that data is sort of siloed, we're not able to aggregate that with other data sources to really, really have something meaningful to create some AI that's going to be profound, let's say, for the patient. So, we need to continue to kind of, knock down the walls of those silos. Obviously, we need to protect the data, but we need to break down those silos so that we can start aggregating, more of that data together. And I would say the other thing that brings up to me, that's sort of a challenge in that same ballpark, is really connecting multiple devices together. And I'll give you a perfect example. I mean, we've talked about consumers as well as patients, but if we're just thinking about the patient, like in a patient's home, let's say that they're participating maybe in a clinical trial, and let's say that they're taking a drug, but yet they're also monitoring their weight at the same time. They're monitoring their heart rate, and maybe they're also monitoring their maybe pulse oximeter, or say. So maybe there's like 3 devices that patient is using, or clinical trial participants using. Well, the challenge is that if those have 3 different apps associated with them, and the patient is, say, 70, and they don't have a smartphone, well, number one, that's the challenge. They don't have a smartphone. But even if they did, are they really going to want to open up 3 different apps in order to load the data from the weight scale, from the pulse ox?
And understand how to manipulate and interact with it to be beneficial for them, which I'm sure, some user experience stuff can be adjusted for that. But you're right. It's how do we bring this all together? It's kind of like, when we're talking about the smart home industry and we're talking about Matter coming in as a new standard, being able to start bringing all your devices together under one standard, as opposed to, if you're locked into this brand and using, Wi-Fi or Zigbee or Z-Wave, like you might be, kind of locked into something that doesn't allow as much flexibility as you'd like. But how do we do that in the healthcare space? How do we bring it so that you can find a company who specializes in a tool to collect some piece of information better than somebody else, and knowing that you don't want to be locked into just using one brand, you want to be able to pull it all into one place, not only just for ease of access, but how can how does, like you said, how can maybe your blood oxygen level reading and your heart rate and your blood pressure, how can all of that be put into an algorithm to really analyze what you need to do and change to just become, get healthier? And if they're all siloed, then that's almost impossible to do. And they're all kind of living in their own little world to say, well, because sometimes what I've learned is that if you just kind of silo out one metric about your body, it doesn't always tell the full story. And in order to really get a diagnosis, you need to know more, right? So we go to the doctor for that and stuff. But if they could interact better, you'd get a better picture for sure.
Yeah, and honestly, one of my responsibilities is to lead our digital health team. That's actually building a digital platform, and you're absolutely right. And there are a lot of our customers that have created their own digital health platforms, and they're great. The challenge is that if J&J creates a digital health platform, Medtronic, which is another big, medical device company, may not want to use J&J's platform. They may want J&J to use their platform. So, with all of these sort of competing interests that have digital platforms, it's going to be difficult to, sort of align on one standard that, that say all of these connected medical devices can actually, link into it and support. And so one of the things that we're working on, because we build products for thousands of different products for, the top medical device and diagnostics companies, is, can we work with them so that we can connect their devices to the hub that we've created, right? So that, it can be seamless for those patients. And decentralized clinical trials, I think, is a really big area that we, are thinking a lot about, where we think that could be a really good benefit, frankly.
Oh, absolutely. No, I couldn't agree more. This is a very exciting space, and lots of steps have been made to kind of get us to where we are, and we have a long way to go to kind of, to live out a lot of the stuff we're talking about. But we're getting closer, and it's the technologies that we have. The more data we get, the better it's going to be. So, so Brad,
Great.
thank you so much for taking the time. This has been a very fun conversation. For our audience who might want to learn more, follow up, kind of engage after the recording, what's the best way they can do that?
Reach me via email, Brad_Womble@Jabil.com, and happy to follow up with anyone out there. And by the way, I mean, this is such a fun topic in an area where there's so much innovation happening. Yeah. Honestly, it is going to take an ecosystem of different groups working together to help solve some of these. And so happy to link up and happy to help promote this area.
Yeah, absolutely. Love to have you and other members of the team back in the future, just because there's a lot of good topics that I know you're all involved in. Love to get your kind of feedback and thoughts on. So thanks again so much for your time, and it was great to have you.
Thanks, Ryan. I appreciate it.
All right, everyone. Thanks again for watching that episode of the IoT For All podcast. If you enjoyed the episode, please click the thumbs up button, subscribe to our channel, and be sure to hit the bell notification so you get the latest episodes as soon as they become available. Other than that, thanks again for watching, and we'll see you next time.